Good day, everyone. You're welcome to Talking Point Show again, and I still remain your host, Odugbose Raphael. Previously on the show, we talked about the medical negligence and its legal implications. The last time on the show, we had discussions with Barrister Adidayo and Barrister Martins. Um, Presently now, I have Dr. Odugbose Joshua, who is a medical practitioner, will be shedding light to what we understand with medical negligence. So, Dr. Odugbose Joshua, you're welcome to the show.
Um, okay, thank you. It's nice to be here. Yeah, thank you.
Okay. Yeah, from legal perspective, what is medical negligence?
Okay, I will say I don't know what the legal guys define medical negligence to me, but I will summarize with just this little note that medical negligence is um, running away from a medical obligation. I would also explain it to mean failing to do that which is in your power and your jurisdiction to do for a patient. That would be my definition of medical negligence.
Okay. So, Dr. Jude, what are those reasons why some medical practitioners engage in medical negligence or in medical malpractice?
Okay. Well, there is a saying, every man for himself. You know what that means? Yes, every man for himself, because every individual has this privilege to stand before a judge or before a panel, either the disciplinary panel or whatsoever, to explain why something went wrong or why an accusation is coming up. And there must also be an evidence for everything. You know, I can't really say that this is the reason why people fall into the issue of medical negligence or not. But however, let's not forget too that there are several factors to this patient care, most especially when it comes to the clinical setting. There are a whole lot of factors that comes in. There is the environmental factor. There is the availability of medical equipment and human resources as at when due. So there are a whole lot of factors to this. You understand? So we can't just look at medical negligence from a single point of view. We really need to broaden our horizon about it. So I can answer that question that says why medical practitioners falling into the trap of medical negligence. So I would say from my own point of view that every man for himself, truly.
Okay. Okay. Now, um, as a medical practitioner, what can you give as an instance that we can say someone has been involved in medical negligence as a doctor?
Well, no medical practitioner prays to fall into the issue of medical negligence. No one prays to fall into that issue. But the truth of the matter is, for an instance, let me give an instance. A patient presents to the hospital to see a doctor after following all protocols and all things being in their usual state, like in the normal state. Let me not use usual, in the normal state. And this patient has attended to this doctor by following the protocol, collect the patient, or get history from the patient. Now, this patient is under your care automatically. You understand? But don't let us not also forget that every patient has a right to be cared for and not to be cared for. What do I mean? For example, a patient comes in with acute abdomen and you've done all you need to do and you are making a final diagnosis of acute appendicitis. And now this patient has agreed or signed consent to go in for surgery, all things being equal. this patient and the doctor or the medical practitioner are on the same page. Now, let us assume this patient has come out of the theater and the patient is in the recovery room, for example, or let's say the patient has been taken to the ward. It is the duty of the doctor and other health personnel to see to the monitoring of this patient until the patient is fit to be discharged home or to go home. Now, I will now bring in the instance where medical negligence may come in, and that is, let's say the patient is on admission in the ward for monitoring and nobody attends to the patient, no daily or vital monitoring, no follow-up, no one is coming to ask, okay, is there any condition or is there any complaint or is anything really going bad about this patient? I can call that medical negligence. For example, I can also say a doctor that knows what he's supposed to do for a patient, after explaining all the procedures and whatsoever you want to do for this patient, and the patient has agreed for you to carry on your care, and you just stay aloof, you didn't eventually carry out that thing that you know is a right or is the right thing to do for the patient, then I can tag that medical negligence. However, I can also bring in an instance and say, okay, a patient comes into the A&E or the ER and the patient comes bleeding or something, for example, bleeding. And you know that there are actually some things you need to do first for this patient, at least resuscitate the patient, stabilize the patient as much as you can, considering that all resources, all the things you need are available to do that. Because we can't be comparing things you can access in a secondary facility to things you can access in a primary facility, or things you can access even in an environment where there is even nothing, you understand? But the point is that you have the power, you are the position of rendering this care for this patient, and you stay aloof or you decide not to. Most especially after this patient has given you consent. You know, it's not in all cases a patient can give you consent. A patient that is dying may not even know what is happening. So you have the autonomy, you have the power to step in to rescue that patient as much as you can. So I will say that if you refuse to do this, I can call that a medical negligence.
Wow. Thank you so much.
However,
okay.
Yes, thank you. However, you know, there are different situations to this, depending on the state of the patient. Is this patient capable of giving consent or not? Does the patient have relatives that can say, yes, go ahead? No, don't touch our patient or don't touch our relative. You understand? So there are contexts to all these things. So I would say that I would call such instances medical negligence from my own point of view anyway.
Okay, thank you so much, Dr. Joshua. Yeah, there are a lot of recurrent cases whereby a patient is being rushed to the hospital, and sometime maybe in a case of emergency, and doctors are available, the nurses are available, or it's not being or the patient is not being attended to, and we have cases that some of those people may even die. Some their cases become more serious. Why do we have that happening? Is it
Okay. Okay. Now let me come in from this point. Now, dividing medical negligence from, let's say, the Medical Negligence in Nigeria Act. There is an act that defines this. And mind you, let us not forget that the medical practitioner, they do their best to care for a patient, but God does the healing. Are we together?
Yeah.
Now, I will say that I will define it like this. A definition of the term medical negligence is apt at this junction, and it says medical negligence can be defined as improper, unskilled, or negligent treatment of a patient by a physician, dentist, nurse, pharmacist, or other healthcare professional. Do you understand?
Yeah.
Now, this is gotten from, I think it's a free dictionary online or something, whatever. Also, a legal dictionary that defines medical negligence. Now, let me use this as the basis of our discussion to unskilled, negligent treatment of a patient. Good. Those three keywords are very important. For example, you gave an instance. You said a patient was brought into the A&E. Did I get you right?
Yeah.
And nobody is attending to the patient.
Exactly.
Did I get you right?
Yeah, exactly.
I would say that this would be a scenario that will be rare in occurrence. What do I mean by that? As long as there is a health professional on ground, no one can leave a patient unattended to. Now, it is different from that, okay, we brought this patient to the ER, nobody attended to the patient was just there. Now, let's always divine this thing further. Okay, for example, I once worked in a government institution where before a patient comes into the ER, that patient must have been assessed by a health physician. By a health professional, either by the emergency nurse or the emergency doctor or the ER, whosoever that is in the ER. This patient would have been assessed. Now, there is something they call triage at every entry in every emergency level. If you triage, let's say, okay, in front of your ER, you have like 3 patients and you have limited space. Let's say you have 1 bed space. Someone has to go and triage these 3 patients and assess their level of how fast or how rapid the response should be. You understand? Before you can say, oh, this Mr. C needs an urgent care, or Mr. B needs more urgent care or more emergency care than Mr. A. That is the essence of triage. For example, 3 persons can be in front of the ER and 1 person is shouting, my head, oh, my leg, oh, my leg, oh. And 1 person is just lying down there. The person is not saying a word, or maybe the person is even finding it difficult to breathe or something, or the person is breathing profusely or something. I can attend to the person that is shouting my head, though, before I attend to someone that is just lying quietly. And I can see that this person needs more urgent care than the person shouting my head, though. I don't know if you understand. So that is a brief explanation of triage. Now, it means that no patient will come to the ER without that patient being attended to. But mind you, if that happens, that is a neglect. I don't know if you understand me.
Okay.
If that happens, it is a neglect. What do I mean? In the sense that, okay, a patient came to ER, they said this patient came in whatsoever shape or whatsoever form, and all the health practitioners that are in the ER just sit down and they continue what they were doing, and they didn't attend to you. Nobody gave you a response. You are just there, and I can say that is a neglect.
Well,
actually that's
Well, I actually asked this question because I've had a personal experience of this kind of situation whereby I took someone, a pregnant lady, to the hospital for delivery. When the water broke, and getting to the hospital for her to be attended to because she's already due for delivery, and all what we could hear from the attendants, I don't know, maybe the nurse and or the likes there, they were saying that there's no bed space, that there's no doctor on ground to attend to her, that in fact, I don't even understand the excuses, and in fact, we just have to rush her from the hospital to another hospital.
So another one. Okay, good. Okay, good. Let me come in here. I didn't want to rush to that point so that it doesn't appear as if, okay, this doctor is giving excuses for his colleagues and the rest. Now, I've also had a share of my experience. I was still in the medical school when my dad called me that he's in the ER of a government hospital. And I was moved. I was like, what are you doing? He told me quickly on the phone that there was a lady that needed an urgent attention on this, and they had to rush her to the hospital. Now, I got there. I was a medical student. I got there. I saw the lady in the car. It was already parked in front of the ER. And they kept telling us that there was no bed space. Now, we were so moved emotionally, like, okay, I was a medical student, so I didn't really understand the situation of the factors around bringing a patient to ER in Nigeria. Now, I thought initially, my thought is that once you drive any patient into the ER, that patient, in short, you can just even go and sit down and the patient will be taken care of, just like what we see on the movies. My brother, it's not like that here. It's not like that, except maybe you are taking the patient to some private centers that are really well equipped and they are good. And they have that proper plan for their ER. It's not like that, because I discovered that then my expectation was actually huge. But when I now got into the scene too, I discovered that wow, there are so many things that so many people don't know about. Now, to cut the story short too, we pleaded. I went in as a medical student. I was on my work coat. I was begging. I said, I'm a medical student. Please, this patient, please, they should attend to. The doctor called me in. There were doctors in the ER. He told me, he said, see, he took me around the ER. All the bed space were filled up. I saw people on slab, on concrete slab. I saw some persons on the bench. So me, myself, I was like, so he was asking me, how do I want them to attend to the patient? I kept quiet. I couldn't say anything. I begged him. I said, okay, can he just come and assess this patient in the car? Let's just even know what to do and where to go and the rest. He came out willingly. He came out. He said, although this is not within the medical ethics, it's not a proper, how will I say it? It's not a proper service that you are attending to a patient in a car. Imagine all the things I've explained earlier. I said some patients were on bench. Patients were on concrete slab. Even a healthy person himself cannot lie down on a concrete slab and be comfortable. You get the point?
Yeah.
So when he came out, assessed the patient in the car, and he advised that, well, we have two options. It's either we hang around till there is a bed space, or we take the patient to another health facility, which were good options. But brother, who will want to go for the option of waiting, hanging around until there is a bed space? Later, I was now interpreting that statement to myself. I was like, okay, a bed space. Does it mean that until the patient is moved into the ward? And how soon will that be? Or does it mean that until the patient park or the patient passes on and let's say the patient dies and they now have to move the corpse to the mortuary? Or are you saying I should wait until the government brings new bed or expand the ER? You understand? It's a broad thing, but nobody will want to wait and say, okay, let me wait. Most especially when you see that, let's say this case is critical, the patient is going, and you say, okay, let me go and wait. But brother, let me not deceive you. That is the last resort of some people. They have to wait. Across board. Do you know what I mean by that? This cuts across board in the sense that, just like the example you gave, that the patient water broke, started passing like water, and you had to rush the patient to the hospital, and they told you there is no bed space, there is no doctor on ground. Let's be candid. There are some government hospitals that does not have doctor on ground. Yes, they don't. They don't have, even some tertiary centers they do not have enough human resources, enough manpower. So how do you want them to cope?
Wow.
And presently, so okay, sorry, let me not talk too much. But the truth of the matter is this: it's not that someone is trying to defend the faulty health system, because we must be candid with ourselves. The health system is really faulty. If you want to be getting this kind of services from our health system, then we really have a lot of work to do. We really have a lot of work to do. It means that the organogram of health structure has to be well followed. Enough primary health care centers that are up to the task. Then from there, you take patients to the next comprehensive health center or the basic health center. from there to a next comprehensive health center, from there to maybe a tertiary health center, from there to the tertiary institution. So there are a whole lot of things. This discussion is broad.
Yeah.
There are a whole lot of things. So, for example, now you can't be living in, let's say, area B in Yanyan, or let me say in Gwagwalada, for example. There is a primary health care center in Gwagwalada. There is one at the central Gwagwalada town, close to the town hall, for example. Now, anything happens to any individual within Gwagwalada vicinity, does not want to go to the primary health care center. Where do you think the person is going to? It's going to the teaching hospital. Now imagine now that Gwagwalada and its environs is receiving a load of that kind load of patients, and there is no inadequate bed space for its emergencies. There are a whole lot of issues. Now, you can't expect a doctor to be in the ER all the days of his life. You understand?
Okay.
Let's assume that you have 2 doctors there. Definitely, they will have to run shifts. So come to think of it, that is only 1 doctor you have in a health center, and you expect the doctor to always be there 24/7. It's not possible. Yes, they signed an oath, but they didn't sign the oath to die. You understand? So now these are situations that
Yeah, so thank you for your lengthy explanation. I want to ask, what is patient negligence? I believe we have something like that.
well, I think usually I'm not aware of a word, or maybe I'm not national word called patient negligence. However, everything still boils down to medical negligence. And patient negligence is just tilting it to patients anyway, which still buttress the point of medical negligence. But what I want to say is this: the patients are usually on the receiving end, and mind you, anybody could be a patient. The doctor too could be a patient one day. I was once a patient. Yes. I went through a surgery too. I was just like a patient, just like any other person. Yes. So anyone can be a patient. So if we want to look at it from patient negligence, it narrows it down to just talking about the patient only, and anyone can just explain his or her ordeal as to patient negligence. For example, if I'm a patient now, I may just come out to the media and say, I was neglected. Nobody came to see me. Nobody came to give me food. Nobody came to bath me or bathe me. Or nobody came to and so on. So coining it down to patient negligence just literally mean that a patient is being neglected. That's the literal meaning. So, and neglect of a patient is not only from the doctors, it's cut across board, all health caregiver, the nurse, the pharmacy, the dentist, name them, the laboratory attendant, and so on. So it's cut across all health caregiver or healthcare provider. So it's not only something, it's common in our environment that once there is any issue as to patient negligence or medical negligence, the doctor is always the bull. Well, we understand. Well, if we may want to accept that, if we want to look at it from the perspective of being a leader or from leadership perspective, because if anything goes wrong, the leader actually has to be held responsible. If something goes right, the leader too has to be held responsible. So I can't really differentiate between patient negligence and medical negligence. The only thing that differs there is that you are narrowing it down to a patient.
Well, I also feel patient negligence should be, maybe someone who notices some health challenge and refuses to go for checkups, he refuses to visit the doctor or a physician to check you or to tell the person.
Okay.
So I feel maybe,
Okay.
you know. So
Okay. I didn't get it from that context. Well, that's not a patient.
Well, from your explanation, I feel, yeah, of course, if the patient is being neglected from the hospital, yeah, the patient. So
Yeah.
from this side also, that is the patient is now the cause of it. It's no longer the doctor now or the medical practitioners.
Negligence. I would say, hello, are you there?
Yeah, I'm with you.
I won't call it patient negligence. I would say that one has to do with health-seeking behavior.
Okay.
Because patient negligence, you've narrowed it down. You know, I was saying you've narrowed it down to patient because you are until you become patient under a healthcare provider, just like from the word patient. Until an individual agrees that, okay, I'm subjecting myself to your advice medically or surgically, then the patient becomes a patient because the patient is now patient. It's patient enough. I'm using words now derivatively to say, okay, now I can't see you on the road and say you are my patient, except we've had a medical or a surgical discussion or consultation, and you are under a long-term treatment. So whenever you come to my jurisdiction, I can say, okay, he's my patient. Okay. Or I can refer to you as my patient because you're under my care. But I can't see you on the street so for whatsoever you are going through. Either you are having a headache or not, and I'll just say you are a patient. You are not a patient yet. It's just that you're the health-seeking behavior or the health-seeking attitude of that patient or that individual that is not good. Let me put it that way.
Yeah, thank you so much, Dr. Joshua, for coming to the show today.
Welcome.
We really enjoyed your explanation, breaking things down and going deeper to make sure that we have a deeper understanding of these things. We would like to have you some other times also on the show.
Yeah, thanks. I would also like to be around. I just wish I could have this broad discussion with the with the Jagabans and the cool practice and
don't worry.
iron our issues out.
Don't worry. Other topics will come that okay, we'll have time to do justice to things. So, ladies and gentlemen, everyone, this is where we draw the curtain of today's show. We hope you join us next time. Thank you very much.